Hey everyone, my name is Mark, and my assignment is about developing a decision support system for concussion injuries. First of all, what is concussion? It's a type of mild traumatic brain injury. It occurs when an individual has suffered a blow to his or her head. Concussion is defined as a complex pathophysiological process affecting the brain. It can result in short-term memory loss of normal brain functions. And in some cases, the symptoms and signs can involve over a number of minutes and hours. Here are some symptoms. Concussion can have somatic symptoms like headaches, cognitive symptoms like feeling in a fog and confusion, and emotional symptoms like lability. The physical signs of concussion are loss of consciousness and memory loss. Some are nausea and vomiting are also common. There are also some behavioral symptoms involved, like irritability, slowed reaction times, and disturbance of sleep patterns like insomnia. I presented some treatments for concussion in the slides. Physically and mentally rest, avoid vigorous movements, limit use of technology, and taking medication like pain relievers. Some background about concussion. In recent years, concussion-related injuries in sports have been the main focus. A number of studies have been done to find out the severity of the effects of concussion, especially when it is not properly diagnosed and treated in a timely manner. Sports players and team management used to ignore minor concussion injuries as they have not been properly educated about the subject. Sport-related concussion has been an issue in the past years here in New Zealand and worldwide. Here are some statistics about concussion in New Zealand. 20,902 sports-related concussion claims in New Zealand between the years 2001 and 2011. 550 active claims made by rugby players between July 2015 to June 2016. Around $12.8 million is spent on concussion injuries claims between July 2015 to June 2016. This does not account for players who have suffered concussion while playing sports in NZ, but never submitted a claim to ACC. A solid concussion check has been developed by ACC to raise awareness. This is one of the past concussion awareness interventions that has had some success. However, players and teams sometimes cheat the system. This results in reducing the effects of the intervention. The last point is that worldwide, in the US, 1.6 to 3.8 million sports-related concussions are recorded annually. Importance of the DSS. These are some points to consider about the importance of developing a DSS for concussion injuries. Early and proper diagnosis of individuals with concussion can avoid long-term effects of concussion. Track medical history of individuals who have suffered past concussions. Guidance for appropriate treatments. There are only few studies done that looks at sports-related concussion injuries amongst the sports participants in NZ. Failure to report concussion injuries increase the risk of more serious effects when a second concussion injury occurs, while still having symptomatic from the first injury, also called second impact syndrome. Concussion injuries can have long-term effects on the life of athletes who are in professional sports and high school sports. Some long-term consequences of multiple concussion injuries are impairments in memory and processing speed and may also result in neurodegenerative disease such as Alzheimer's. Recovery from subsequent concussion injuries may take longer as usual too. It's important that there is a way to keep an active record of players' injuries as this will aid in keeping track of the history and recovery time. Most importantly, keeping a record of an athlete's concussion history will help the team physiologist and the management in deciding if a player needs to be sidelined and put through a rehabilitation program. Data collected can also help in research studies. Moving on to the overview of my DSS for concussion injuries. As you can see, I have 4 nodes under my DSS. I divided them into inputs, outputs, process of diagnosis, and management of injury. I will each discuss the inputs, process of diagnosis, and management of injury in their own slides. First of all, is process of diagnosis. This is the first step in the process of concussion. This is mostly done on the sidelines when the injury occurs in sports of field of play. As pointed out before, it is important to diagnose concussion as early as possible to avoid further injury that can happen if the player is placed back in the field of play. The immediate symptoms that need to be looked out are for dizziness, confusion, loss of consciousness, slurred speech, and delayed response to questions. This can be easily assessed on the sidelines. I have made a different heading for the chance of delayed symptoms. Sometimes, when concussion occurs, symptoms do not show immediately. This can happen when the injury occurs in day-to-day routine. Sometimes this also happens a few hours or maybe days after playing contact sports. Some of the symptoms listed are sensitivity to light and noise, sleep disturbance, changes in behavior, and concentration difficulties. The seventh slide now discussing the inputs under DSS. The important information under the inputs are the concussion history, first of all. This part will tell whether it is the first time the individual has suffered concussion in the past. The last time the concussion injury happened. It is important as repeated concussions have long-term effects. Some of these effects are motor system functions, neurodegenerative disease like Alzheimer's. An important note is that it is important to know if they are still symptomatic from the last injury while the second concussion injury occurred. This can result in rapid neurological deterioration, disability, or even death. Knowing whether there is loss of consciousness over here and its duration is also important, along with the recording symptoms present. Data like severity, gender, age group, and sports played are important and can be used for research studies. The last part of the DSS for the concussion injuries that I'm going to discuss is injury management. Injury management is an essential part of recovering from concussion. I added observation for persistent symptoms as this can tell the estimated recovery time of the individual. This is also connected to if they suffer a second concussion injury. This can help in how to treat the individual. The rehabilitation process that I have added is specific for individuals that play sports and for their team management. Although, this can also be used as a guideline for individuals who suffer concussion injuries that are not sports related. The rehabilitation consists of 5 stages: no activity, light exercise, no contact drills, full contact drills, return to play. This can be used as a basis for concussion protocols in sports leagues. Clinicians can also use this process to aid in planning a recovery timetable for their patients while keeping data on the recovery process. Some points of discussion. The strengths that I see for the development of my DSS from concussion injuries are: the strengths are keeps an updated medical and concussion history of individuals, ease of concussion diagnosis, and guidance for rehabilitation. Although I see one limitation for my DSS. It is not as comprehensive as using the Open EHR archetype. Open EHR archetype will be useful for recording comprehensive and complete data. It can also record biological processes and long-term effects of concussion properly. These are some references that I use for this presentation. I find them really useful, so if you can check them out, you can. And thank you for taking the time and watching my presentation, and I look forward to your feedback.